Hello and welcome to this unit on medical directives. In the last unit, you spent time thinking about what would happen if you were alive but unable to manage your finances. We talked about how, if life took a detour, your bills could still be paid, your property managed, and your financial gears kept turning. But financial stability is only part of the picture. Now we're turning to the medical side of incapacity planning, the care you receive, the decisions that may need to be made, and the person who would speak for you if you cannot speak for yourself. This unit isn't about what happens after death. It's about what happens if you are still here, but unable to clearly communicate your healthcare choices. It's about making sure your wishes are understood, and it's about making sure the people you choose to help you can work together when it matters most. As you may recall from the previous unit, you are the principal. You are the one building the system. And during a period of incapacity, there are typically two roles that need to be filled by people you trust. One is your financial needs, which require a financial agent. You've already explored that role. That person manages money, property, accounts, and logistics. The other is your medical needs, which requires a healthcare agent, sometimes called a medical proxy or healthcare surrogate. That person communicates with doctors, reviews treatment options, and serves as your voice for medical decisions. These are separate authorities. They operate under different documents, and they often require different strengths. A financial agent typically needs to be organized, steady with numbers, and comfortable dealing with institutions. A healthcare agent needs to be calm under pressure, able to ask questions, and confident advocating for your values in a medical setting. Sometimes one person is well suited for both roles. Other times, people divide those responsibilities. There isn't a universal right answer. What matters is recognizing that these roles are different, even though they may both become active during incapacity. This is where coordination becomes important. Medical decisions and financial decisions rarely exist in isolation. A healthcare choice may involve costs. A financial decision may affect what care options are realistically available. If the two representatives aren't aligned or don't understand your priorities, confusion can arise. Not because anyone is acting improperly, but because the system wasn't designed to function as a team. For example, a healthcare agent might determine that home-based care reflects your values. A financial agent may be responsible for arranging payment. If those two people aren't aware of your preferences or each other's roles, it can create unnecessary stress during an already difficult time. That's why we talk about integration. An incapacity plan works best when it's viewed as one coordinated system, not a stack of unrelated documents. If you choose different people for these roles, it helps to consider whether they communicate well. And if they don't naturally collaborate, having your preferences clearly documented can reduce friction and uncertainty. Sometimes clarity is as simple as making sure both agents know who the other person is, how to reach them, and where important documents are located. Earlier, we discussed the idea of keeping essential information accessible in one place. This doesn't require complicated binders or technical detail. It simply means creating awareness, a short list of names, basic contact information, a clear understanding of where documents are stored, perhaps even a simple first 24 hours reference page so no one is scrambling during an emergency. The goal isn't perfection. The goal is reducing friction during a stressful moment. As we move through this unit, we'll look more closely at medical directives, what they are, how they function, and how people document their healthcare preferences in advance. For now, here's the key takeaway. Financial authority and medical authority are different roles. Both can be essential during incapacity, and thoughtful coordination between them can create stability when it matters most. You can choose to have one person serve in both roles, or have separate individuals serve in each role. Your plan is not just a collection of documents. It's an integrated system designed to protect you. So stay with us. Let's begin building the medical side of your roadmap.